for Lisa Mooney. Lisa, how do I talk to my children about them being at risk?
This is a really good question. I think with kids, the best thing to do is, one, you have to look at their developmental age. You're going to talk to a teenager much differently than you would talk to a 5-year-old or a 6-year-old or a 10-year-old. So you do have to look at their developmental age. If you do have kids that are developmentally at different ages, it is best to talk to them each separately because they're going to have different needs and you're going to need to give more information to older kids than you would necessarily to younger kids. There's no right or wrong way, definitely. The best thing to do is to name the disease, whether you name that disease Huntington's disease or whether you name it a brain disease or your code you have for your house, definitely name it something. Don't just call it a disease or mommy sick or daddy sick or anything like that. Remember, you can be sick with COVID, you can be sick with cancer, you can be sick with Huntington's, you can be sick with a lot of things. Depending on their developmental age, if you haven't named it, if they come down with a cold or something, they might also think, oh, I'm going to turn into daddy or I'm going to turn into mommy right now. You want to avoid that. So naming it is really helpful. The other thing is to let the kids take the driver's seat as far as how much information they want. Kids are usually really good. They will ask the questions and you can answer the questions based on what they ask. I think, Katie, you could probably share better, but kids are not going to ask you when you're sitting around the dinner table. In most cases, they're usually going to ask you when you're dropping them off to soccer or something like that. So you do have to be prepared for it at any time. Sometimes if they ask a question and it's not the ideal time or you don't have time to fully address it, it's important to just say, that's a really good question. Let's talk about it tonight at dinner time, or let's get on the internet together and research it, depending on their age. There's lots of resources out there for kids. HDYO has an amazing website that I access often myself as a professional, but they have an amazing website that helps give you some ideas at all levels about how to talk to this with your kids. But it is important. Kids are very, very astute and they know something's going on. Pretending like everything's fine is not going to work for them. If you don't share the information with them, they will go try to find it somewhere else. Unfortunately, the internet is full of false information about Huntington's. You want to make sure that they feel like they can come to you and ask the questions. Maybe they're not ready to hear about it, but just reaching out your hand and saying, when you're ready, mommy or daddy or whoever, we're happy to answer any questions that you might have about this. We know you might be scared. We're scared too, but we're going to get through this together. And just reassure them that you're going to be honest with them.
How to talk to your kids about being at risk or having Huntington's disease in the family. One of the worst things you can do is not talk to them. I completely agree with Lisa's advice in terms of how to approach it. Every kid's going to be different and take their lead, but to shove it in a closet and pretend that it isn't there is probably the worst thing that you can do for families. And talking about it when they're ready, there's never a good time to talk about bad things. But when they're ready, then it's appropriate to talk to them at their level. And they will find out information. It is amazing how much information is out there through different means, but the internet is just in everybody's pocket these days. They will go and search for that if you don't take the lead.
As being a parent with 3 children at risk, I think the best advice I got from my UC Davis team and all my friends was do not lie to them. That was something I took from the very beginning, is don't lie when they ask questions. But I thought the at-risk question would be the hardest, but really it was more talking to them about end of life was the hardest for me. Talking to them about hospice. When their dad went on hospice, it scared them. We sat down one day, the 3 of us, and my oldest one asked a question, and then my other 2 just started crying, and they asked me questions for hours. I didn't realize how many questions they had and how observant they were and how they weren't asking me these questions because they thought it would push me over the edge. You're already going to the care home. You're already watching dad pass away. We're watching dad pass away. We don't want to rock the boat with mom because she's already on a tightrope. And then when they asked me all these questions, I felt horrible because once we answered them and we spent those couple hours together, we all just felt so much better that we talked.
Talking to them the truth and what's going on, just more fact-based than anything else, sets up an open relationship so that if they have questions later, not just during that emotional time or that period, that they are going to feel that it's an open door rather than we shouldn't talk to mom about anything.
Katie, thanks for sharing that story because I think you perfectly elucidated some of the issues. I would also say, even though you have one conversation doesn't mean that The job's done. It'll be a continual process of everybody being able to process.
Just to add, you're not alone. There are many times where I've spoken to teenagers or other people in the family about what's going on because they just have questions that's beyond what the family member either feels comfortable talking about or has the information. That's what the team of people behind the caregivers and patients are there for. And so please take advantage.